How do bladder cancer chemotherapy drugs work? Imagine fighting cancer with powerful medicines that target the very cells causing trouble. Chemotherapy drugs for bladder cancer work mainly by attacking cells that are rapidly dividing, which is a hallmark of cancer. These drugs interfere with essential processes inside the cells, such as copying DNA, making RNA, and building proteins. When these processes are disrupted, the cancer cells can no longer grow or divide properly, leading to their death. Sometimes, the drugs cause the cells to undergo programmed cell death, called apoptosis, which is a natural way for the body to eliminate damaged cells. There are two main ways chemotherapy is given for bladder cancer. The first is systemic chemotherapy, where drugs are delivered through a vein. Once in the bloodstream, these medicines travel all over the body, reaching cancer cells in the bladder and anywhere else they might have spread. Common drug combinations include cisplatin with gemcitabine or a regimen called MVAC, which includes methotrexate, vinblastine, doxorubicin, and cisplatin. These drugs work by damaging the DNA of cancer cells or stopping them from dividing. For example, cisplatin forms crosslinks in DNA, preventing it from copying itself, while gemcitabine mimics building blocks of DNA, blocking its synthesis. Because these drugs target rapidly dividing cells, they can also affect normal cells like those in hair follicles or the lining of the digestive tract, which explains some common side effects. The second approach is intravesical chemotherapy, which involves placing the drugs directly into the bladder through a catheter. This method is mainly used for early-stage bladder cancer that hasn't invaded the muscle. Drugs like mitomycin, gemcitabine, valrubicin, epirubicin, and docetaxel are used in this localized treatment. The goal is to kill cancer cells lining the bladder while reducing the risk of side effects elsewhere in the body. This approach is often used after tumor removal surgery or if immunotherapy with Bacillus calmette-guerin does not work. Chemotherapy drugs can also be classified based on how they affect cancer cells during different parts of the cell cycle. Some, like gemcitabine, act during the synthesis phase by blocking DNA replication. Others, such as vinblastine and paclitaxel, interfere with cell division during mitosis by disrupting microtubules, which are structures that help cells divide properly. Alkylating agents like cisplatin cause direct damage to DNA, which triggers the cell's death pathways. Using combinations of these drugs helps attack cancer cells at multiple points in their growth cycle, making treatment more effective and reducing the chance that the cancer will become resistant. In summary, bladder cancer chemotherapy drugs work by disrupting the molecular machinery that cancer cells depend on to grow and multiply. Whether given systemically or directly into the bladder, these medicines aim to destroy cancer cells while trying to minimize side effects. Treatment plans are carefully tailored to each patient based on the stage of the cancer and overall health. It's important to remember that chemotherapy is just one part of a comprehensive treatment approach, and always under the guidance of healthcare professionals. If you or a loved one are facing bladder cancer treatment, talking with your medical team can help you understand the options best suited for your situation.